we're continuing our discussion on hormonal health with Dr. Mark Opperman from the T Clinic. And today we're going to be taking a closer look at the safety of hormone replacement therapy in men. Now, Mark, a lot of people are very aware of the benefits of hormone replacement therapy, but concerned about the possible pitfalls or negative side of things. So how safe is hormone replacement therapy?
Michael, in one word, yes, it's safe. I think the majority of people have concerns when it comes to 4 major systems or diseases. 1, does hormone replacement, especially testosterone, cause cancer in men? And the next one is cardiovascular. Is there an impact on cardiovascular health? The next one would be, is this affecting my kidneys? And most probably the last one would be something related to metabolic disease. Let's make it diabetes.
Right.
So let's start with prostate cancer. The answer is, does testosterone cause prostate cancer? An emphatic no.
Okay.
The thing that I think we need to understand is that testosterone does not have a causal effect when it comes to cancer. As a matter of fact, the contrary. It will protect you against prostate cancer. So how does it protect us against prostate cancer? Very simply, if we can prevent the onset of age-related diseases like male menopause, we delay the onset of diseases like cancer, etc., etc. It's very interesting that in men who already have intraepithelial neoplasms, so this is basically changes of cancerous changes in the prostatic endothelium, that it will slow down the progression of this. So a very big question that we get confronted with in the practice is, I've had prostate hyperplasia, in other words, the prostate's getting bigger, or I've been treated for some form of prostate cancer. Now, what can I do because it's 10 years later or 5 years later and I'm showing all the signs of hypogonadism?
Okay.
And then, yes, we can safely treat these patients. So it just boils down to the fact that testosterone will not cause cancer. It can fuel existing cancer. And this is why we see a higher diagnosis of cancer in patients, for the simple reason, if you do hormone replacement therapy safely, you will be on the lookout for cancer.
Okay, right.
So it's not causing it, but you're more likely to find it because it's already been there.
Yes.
And now you're looking for it.
Yes.
So on the cancer side, you know what? No, it doesn't cause cancer.
Okay.
From a cardiovascular perspective, historically, they always thought that testosterone can aggravate or cause cardiovascular disease. Now, that has been proven to be wrong. For one simple reason, from a cardiovascular perspective, optimal levels of testosterone leads to lower blood pressure. It leads to less glycemia, in other words, less glucose in the blood. It has an incredibly favorable effect on cholesterol levels, where it brings down the total cholesterol. It brings down triglycerides, the free fatty acids, and it elevates high-density lipoproteins, in other words, the good cholesterol. So it has a role to play in decreasing vascular inflammation, and therefore protects us against cardiovascular disease.
Right.
Men with low levels of testosterone have a far lower mortality rate than people with optimal levels of testosterone. And when we look at optimal levels of testosterone, it's actually testosterone levels of young adult males. So again, this is a protective thing if done correctly.
Right.
And I have to place emphasis if done correctly.
Yes, yes.
For the simple reason, one of the effects of testosterone is that it creates more red blood cells. More red blood cells is classified as polycythemia. So if you have more blood cells, the blood becomes thicker, if you want to call it like that.
Yes.
So the viscosity elevates, and therefore you have a higher blood pressure, which can tax the heart. But if it's managed correctly, and if you manage polycythemia, that becomes a negative risk factor.
Right.
For kidneys, this for me is amazing. If we look at mortality rates of men with stage 3 and stage 4 kidney disease, so this is fairly advanced. Low levels of testosterone has a 10 times higher mortality rate than men with high levels of testosterone. So it's common practice in chronic kidney disease patients to supplement testosterone because it improves the filtration rate of your kidneys, it decreases uric or urea levels, as well as creatinine levels, which are the first signs, if they start elevating, that we're going into kidney disease. For me, one of the most important and most wonderful effects of testosterone is the effect that it has on our insulin sensitivity. So it optimizes your communication of moving glucose out of the blood into the cell. Testosterone improves that communication. So as your testosterone level starts dropping, we become less sensitive to the effects of insulin, leading to insulin resistance, and that then starts taxing your pancreas to start producing more and more insulin, leading to type 2 diabetes. So in a nutshell, is it safe? Yes. Are there risks? Absolutely. And this is where consulting with someone that understands hormone replacement and optimization in relation to your comorbidities, your medication that you're taking, so incredibly important.
And I think it's very important, Mark. I mean, your process is very much consultative with the client or the patient. And I think a comment that you made about the fact that because you're looking so deeply into things, you discover these problems. So it's not necessarily a cause of, but an exposure to, or an exposure of, rather, of these conditions that may be there. My next question was going to be, are there certain candidates who are not good candidates for hormone replacement therapy that need to avoid it?
So firstly, men need to remember that they can get breast cancer. So if you have active cancer, whether it's prostate cancer or breast cancer or suspected, I would not put you on treatment.
Right.
Polycythemia, guys with already elevated red blood cells and hemoglobin and hematocrits should not go on to testosterone until the polycythemia has been sorted out. There is relative contraindications in the sense of obstructive sleep apnea. For one simple reason, obstructive sleep apnea, where you're not breathing properly at nighttime, leads to an increase in red blood cell production. Why? Because we need more red blood cells to carry oxygen because you're not breathing properly.
Absolutely, so not getting up into the system.
So if you have obstructive sleep apnea that's not being treated, be careful of hormone optimization because you can compound the problem.
Right, right.
So those are your relative contraindications. Contraindications. What I would like us to understand is the difference between risk and a side effect. Side effects are predictable. So let's, for instance, say that you take a headache tablet. We can predict that in a certain amount of people, it's going to create drowsiness. Okay, so that's a side effect. Risk is something completely different. I like to use the analogy of Eskom because we can all relate.
We can all
to
relate.
it at the moment. So if I have a trained professional that knows what he is doing, working on a boiler or on one of the generators, there's low risk that something will go wrong. If I have someone that's not experienced or doesn't have a correct training working on this thing, we know that the risk of us going into a higher stage of load shedding is bigger.
Yeah.
And this is what happens with hormone treatment as well. If you get it right, you lower the risk of anything happening.
Okay.
If you don't know what you're doing, and especially guys that think that they can do this on their own,
Yes.
they change their risk profile. And now you start running into trouble.
Absolutely. So, Mark, I think ultimately it's also very much about the relationship between the practitioner and finding somebody who you can talk to openly, who will give you the facts, who's not hiding behind anything and clearly knows what they're doing. So, if somebody wants to have the discussion with you, Mark, where would they get hold of you so that they can sort of consult on the possibility of this treatment?
So the easiest is we're on social media, follow the T Clinic. The website is www.thetclinic.com, and our branch is here in Johannesburg, 010-824-1393. But if you're in anywhere else in the country, you'll be able to get hold of us through that means.
Great stuff. Mark, thank you so much.